Do you have a friend who wants to know what basic care we have to take regarding our penis? My name is Eduardo García Cruz. I have been helping men who have problems in the sexual sphere for more than 15 years. I am a urologist and I am going to explain to you 5 things that you may not know that you have to take into account when it comes to making your penis work as well as possible. And I'm going to start with one that may surprise you, which is hygiene. But by hygiene I mean excessive hygiene. One of the problems with having excessive hygiene is that we moisturize the skin too much, and that can lead to infections due to a fungus called Candida albicans. Therefore, and this is something that I have encountered in consultation hundreds of times. You have to shower, wash, whatever, once a day. But you don't have to wash more times, because that way what you do is moisten that skin too much, and what that produces or what can cause is more infections due to this fungus, and it is something that I do not recommend in any way. Therefore, what I would tell you is to wash regularly, once a day, wash before sexual relations and also after if you want. But dry yourself well. It is very important that the penis is dry, that it is not wet, and that you do not wash it more frequently, because that can lead to the fact that you have more fungus, that you have more Candida albicans. The second thing I wanted to explain to you, which is something you have heard hundreds of times on TV, you have read on the internet, is tobacco and alcohol. Tobacco impairs blood flow to the penis. What alcohol does is that we have more sexual desire, but it takes blood away from the penis, and therefore it is something that I do not recommend doing at all. You know that smoking and drinking are bad, but with respect to the penis specifically, they are 2 risk factors closely related to erectile dysfunction and testosterone deficiency. The third thing I wanted to talk to you about, and this is a concept that, especially in the Western world, is less known but is practiced on some continents, is that when we have an erection, what some people do is bend their erect penis to lose it because they are uncomfortable having an erection in public or in some circumstances, or also for religious reasons, and they bend their penis. Although in Europe and America it is not usually a very common practice, this practice is called takanden. In some countries, as I told you, in Africa and Asia it is done, and that can produce an increased risk of penile fractures. And therefore it is something you don't have to do. If you have an erection, it is as simple as letting time pass, concentrating on something that is not erotic, and the erection will go away, okay? But don't try to force it, don't try to mechanically end the erection, because that can be a problem. The fourth thing I wanted to explain to you, which you may have also seen, is the issue of condoms, but I want to explain something that is a little technical but is very useful. The condom prevents. It is the best way to prevent sexually transmitted diseases, but many people use what is called casual use, which is in foreplay. I do not use a condom and only use a condom during penetration, and we know that it is related to much more probability of infecting or contracting sexually transmitted diseases, and therefore I would tell you that if you are having relations with a person who is not your stable partner, it is possibly a good idea to use what is called ideal use of the condom, which is to wear it throughout the sexual encounter and not just during penetration. And finally, and this is something that is surely less known, is the relationship that exists between obesity and penis problems, possibly through 2 mechanisms. The first is that what obesity does is, logically it increases as men, fat accumulates in the belly, and that very usually produces that sensation of a small penis or a buried penis. The second is that this obesity can lead, through the aromatization of testosterone, to a decrease in testosterone levels, and therefore to having less desire and less erection, and especially in young people, in adolescence. This aromatization can cause it takes longer for you to develop that you have a somewhat smaller penis, and therefore it is very important for both adults and adolescents to be at the correct weight, to do physical exercise, because that will avoid this aromatization of testosterone, and therefore you will to have less belly, a feeling of having a bigger penis, and your penis will function much better. In addition to what I was explaining to you, some people do not gain weight even if they eat poorly. But in here I want to make a point. Being thin is desirable, but diet is very important. That is, if you eat a lot of fats or a lot of sugars, especially if they are refined, although you do not have the natural tendency to gain weight, but that diet can cause endothelial dysfunction, erection problems. And that is why today I recommend the World Health Organization. The two diets it recommends are the vegetarian diet and the vegetarian diet. Mediterranean. And what I recommend is that you follow these two diets as much as possible to be slimmer, but also to obtain high-quality foods and compounds, which will prolong your sexual life, will improve your erection. There is a very interesting study that talked about a sedentary lifestyle and the relationship with erectile dysfunction. It is well proven that people with a sedentary lifestyle have more serious erectile dysfunction, and therefore diet and physical exercise are always good ideas. If you found the video interesting, give it a like and subscribe to the channel, and remind you once again that on Sunday we are doing live shows to answer all your questions. Stay tuned for the shorts and the channel because you know that in Te Un Amigo Q we have a lot of videos about urology and sexuality. Until next time.